Okay, so my case study was on an extended stay. These are the contents. So the overview is that a 64-year-old man named Mr. Lonborg came to the hospital because he had issues with COPD, which is chronic obstructive pulmonary disease. It was beginning to become worse, and that leads to respiratory infection. So he was injected with IVs to help his organs, which seemed to start working. Unfortunately, he proceeded to have acute pain in his lower leg, and the care team resident noticed that his prophylaxis was not given to him, so therefore he had blood clot in his leg. So he was in the hospital for an extended time on IV. Later that night, he fell due to a seizure because his levetiracetam was not given for prevention of seizures. The physicians in pharmacy did not notify the doctor that the medications weren't given, and the automatic alert for medicine was not present. So the primary ethical issue is that the proper medications were not given, and there was a lack of communication between physicians, pharmacists, and the doctor. So the prophylaxis was not given, which prevents deep venous thrombosis, which is blood clots, and that was not given for the pain in his left leg. Then the levetiracetam was not given, which prevents seizures, and the medication administration did not put the medicine in the automatic dispenser, which tells Mr. Lonborg that he should take the medication. The physicians and pharmacists failed to tell the doctor that there were no present medication in that automatic dispenser. So under deontological ethics, an ethical person must follow the rules. So the physician did not supply Mr. Lonborg with prophylaxis or levetiracetam, and the medication dispenser was not routinely checked. So the physicians and pharmacists did fail to communicate with each other. So our intermediate conclusion is that routines that are set in place for safety and health of the patient were not followed. So the conclusion under deontological ethics is that it was an unethical decision. Ethics of care, a moral person who focuses on the care of their interconnected relationships. So out of the care of the patient's health and safety, the physicians and medical administration team could have done better. The resident who noticed that there should have been a medication earlier that day should have said something sooner. And the care for a patient's health and safety is the most ethical code to follow by. So therefore, they did not take enough pride in ethics of care, and it was an unethical decision. So our ethical code, this is the National Association for Healthcare Quality, which is the code of ethics for healthcare professionals. These are the two most ones that they did not follow that I saw: healthcare recipients and providers. This is what they should be doing as healthcare professionals, and they should follow by for the protection of all their recipients. So potential objections under deontological ethics. From a deontological standpoint, the physicians never had direction from the doctor to prescribe the medication. Therefore, there was a lack of communication, and the decision to not provide Mr. Lonborg with the no medication was ethical. Under ethics of care, from the ethics of care standpoint, the ethical code states that the care for all recipients is crucial. So the physicians showed care and safety when they did not provide medication without doctor order. So that decision made that ethical. The conclusion under deontological ethics and ethics of care, the decision to not provide proper medication to Mr. Lonborg was unethical. There should have been more communication between healthcare professionals, as the safety and health of the recipient is the most important part of a healthcare job. And these are my references.